Generations United, The Making of Blended Community, presented by
Morgan Haywood.
Haley Levings.
Ryan Orozco.
Zari Vaughn.
Lorena Martinez.
University students and older adults experience loneliness, financial strain, and major life transitions. Even though they're in different stages of life, they share similar challenges. Our project proposes a blended living community that brings these groups together for mutual support. Using developmental psychology and well being research, we will explain how shared living can reduce isolation, build stability, and strengthen connections. This presentation will outline the issue, review research, and show how intergenerational communities can improve well being for both groups.
The current literature available on senior adults examines how loneliness, cognitive function, housing, and unemployment are current challenges that are plaguing the senior population. Research on the topic shows how combining intergenerational activities and programs can be one way to help reduce these challenges for senior adults while also providing some benefits to our youth who engage in these programs. In a study by Peters, the authors looked at how intergenerational programs bring communities together, stating that interactions between non-familiar older adults and younger generations is emerging as a tool to reduce social isolation in older adults. The authors state how social isolation is associated with adverse outcomes for senior adults, such as cognitive decline, loneliness, and dementia, proposing that a blended community may be one solution to increasing positive outcomes for the older generations.
Students and older adults both struggle with social isolation, which harms mental and physical health. Research shows that steady, real life intergenerational interaction is more effective at reducing loneliness than short term or virtual programs. Because both groups need consistent connection, a shared living environment offers dependable support and a sense of belonging. This approach is backed up by the findings of Shankar 2023 and Fain 2022.
So, who are our residents? In our blended community, we hope to include senior residents ranging from the ages of 65 to 85, and our college students ranging from ages 17 to 25. Since we are more of an assisted living type facility, senior residents are expected to have a certain level of autonomy, while our students are just those who are seeking financial assistance and help covering school costs. Looking into the demographic, for both our senior and college residents, we do not base our selection on race, color, religion, sex, national origin, disability, gender identity, or genetic information, but we do have an age restriction in place as stated before. No other characteristic or demographic requirements are required. Since it is a blended community, it would be redundant to um, be selective based on characteristic or demographic. Some research to back this up. Intergenerational interventions help both senior residents and college residents develop a sense of belonging and improve mental health. And activities that we have planned, such as wellness nights and living in a shared apartment, can help feelings of depression and loneliness, and promote a greater understanding for different generations. This strengthens generativity, happiness, sense of community, and sense of self. On who will be excluded, apart from the residents falling outside of the age restriction stated above, we would only exclude based on autonomy level due to the limited space that we have for memory care and high risk residents. Once that limit is reached, then we would have to exclude based on autonomy level. For how many residents, it is a 4-story apartment type housing. For every floor, there will be 40 units. On the first floor, as I've stated, would be for memory care and high risk patients. So that would be only one person per unit. For the latter three floors, there would be a senior resident paired with a college resident, equaling a total of 280 residents. The only assessment for selection would be autonomy level. This would be looked at by the activity level, fall risk, and dementia risk. Um, Adding to this, for both senior and student residents, a full background screening will be done, including like criminal history, unpaid dues, and a drug screening will be done. For students, any previous academic dishonesty or probation will also be looked into. Going into room arrangements, as I've stated, since autonomy will be assessed, if the autonomy level is low, the senior will be assigned to the first floor, which would be for memory care and high risk. If their autonomy level is high, they will be eligible to be paired with a roommate. We would use a roommate pairing app to assign a senior with a student. On the first floor, there will be 24/7 nurses and medical staff. Medication will be revised. Although that they are higher risk, we do not aim to have a traditional hospital room, rather an apartment-styled room for their comfort. For the other 3 floors, the same applies, a 24/7 nurse station and medication help. Um, on the first floor, there will be a communal cafeteria where residents can dine in or take their food to go. And the common room on the first floor will be where the wellness nights are hosted and any other community events. Other than that, all of the facility is handicap accommodated with multiple rails and elevators.
Side would be for the students, the younger residents, as well as the right are for our elders. As you can see, we have a parking garage, library, mall, site clinic, everything that they would kind of need in order to go about their every single day lifestyle. We created a buddy system just so we can kind of have a dynamic, going about our residency. It can be a unique way for patients meeting other patients in the differing age groups. It would be great for the younger age group to help and guide the elders. Maybe the elders can kind of guide the younger generations and spread some knowledge and wisdom throughout the whole entire residency, and it'll kind of create a more homey environment. Not a lot. It is definitely just the bare minimum that we want. We want them to feel at home. So definitely participate in medical care plans. If they have medication, definitely stick with that and just respect all the living spaces, engage in group activities. If we have social events, of course, respect the property, take care of yourself if they are able to, and just follow their personal schedule.
This presentation highlights 5 locations support the key areas of student wellness and also for age-friendly domains. The Office of Disability and Accommodations promotes psychological wellness throughout accessibility classrooms, assistive technology, and mobility support, connecting domains like outdoor spaces and buildings. The psychology clinic advances psychological wellness by providing therapy, assessments, and mental health services aligned with community support and health services. And then the Counseling of Human and Development Center strengthens emotional wellness throughout counseling, crisis support, and telehealth, ensuring accessibility and emotional care. Pretty much just telling you what each plays and things provide for you. For example, the library mall will like help you be more social. The psychological clinic will help you with like mentally and etc. And then the financial will just pretty much just help you with like financial issues for students, like with classes or living and etc.
AARP's 8 Domains of Wellness maintains that certain aspects of community, such as the built environment and the social environment, are interconnected and can be used as a tool to increase the well-being of older adults. Social isolation and loneliness are predictors for adverse health outcomes and relationship outcomes and are present in both emerging/young adulthood and in senior adults at relatively the same rates. By developing a blended community that focuses on utilizing outdoor spaces and buildings, and by providing a comprehensive plan for transportation and housing, we can help alleviate some of the financial stressors and emotional stress related to accessibility and security in the community for our older adults. Through the creation of our student-led buddy systems, volunteer opportunities, and senior wellness events, there are many roles and jobs provided for both our students and seniors to enhance their work and civic engagement.